presentation.
Okay, class. So I hope you all have fun with the assignment I gave you last week. Just just kind of the introductions to the SBAR, the way to communicate in medicine. You may have an idea what we are using it for. Basically, to communicate between two persons about a patient and for a specific situation. So it's not a presentation. It's not a case presentation. You don't have to go through the whole case. You just gather enough background information to tell the other person about the specific situation that you want to communicate. Yeah. Of course, if you sign out, oops, there's an echo right now. If we wait a little bit. Okay, let's have the camera and speaker first and we continue then.
Okay, before we go
ahead.
on,
Let me know. Yeah.
Yes.
Let me know when.
Yeah, I have some feedback to your assignment. I think that some of you understand well what we have to do, and some people really don't understand what assignment that Dr. Mindo gave you. So you see that like here today, we try to do the presentation using the SBAR framework. So suppose, so you see that like you have to know who you talk to. That's it. It's a sign that you talk to whom, and then you introduce yourself with that person, and then you give the situation, the background, your recommendation. So make it short, but it's go directly. Suppose that you talk to really the real person, okay? So if they say that Dr. Mindo assign you that you have to talk to your radiologist, so you have really talk to the radiologist, not that, okay? So just make sure you have the correct assignment. Okay, thanks.
Okay, are we ready? Is all set up on the other side?
Yes.
Okay. So today we have one camera, so that's fine. Okay. Again, SBAR is to communicate between two healthcare providers about a specific situation. So if it's a sign out between provider to provider about a patient, then it's more in detail, more elaborate. But still, we focus on what you sign up from the day shift to the night shift. We just need to tell the night shift the background of the patients, what you expect may go on during the night, and what you expect the other person to, what you recommend the other person to do if things happen. It's the more complete form of SBAR. But most of other situations is very specific, like you ask the radiologist to check something for you, the gallstone, the suspect esophageal cancer. You give enough background that point toward that suspicious diagnosis, and then the radiologist will target the reading so that they can give you the better answer. So again, it's not the whole case. You don't have to tell like family history, irrelevant surgical history, drug allergies. If it's not relevant, you don't need to tell. You just need to focus the background for that situation. Again, let's try. We have several more classes for this SBAR practice, so don't feel worried. We do one after another. We give you feedback, and we improve from that. Okay. So I have your 3 cases over here. So let's pick team A first. Let's pick one from team A. I give you a situation and try to give me the next part of that situation, and we give you feedback along the way. Hopefully the next one will get better. Okay, so team A, anyone volunteer from team A? Yeah, maybe and you may call name then. Anyone from team A ready to come up?
Yes.
Who is that from team A? Dr. Fu? Who from team A?
We will go first.
Okay, so yeah, so team A. Okay, so just tell me your primary diagnosis for team A. Just make sure that you know about the case and understand what's going on. So tell me the primary diagnosis, what you have in mind about the case.
The primary diagnosis of my team is cholecystitis.
Okay.
Of stone.
Okay. So yeah, so for one case, there's many situations happened to a patient, right? Since the patient came to the hospital all the way till the patient got discharged, then many things may happen during that time. So let's see. So the situations right now here is you, the student. You see the patient in the emergency. You suspect she has cholecystitis, and seems like she could not eat, could not tolerate food. She's been dehydrated. You think she may need some IV fluid, and you want to tell your provider, your supervisor, that she may need some IV fluid. How should you sum up the case, and how should you present to your supervisor that you think your patient needs some IV fluid? Let's start with a very simple situation first. So you tell about the situations. Patient dehydrated. You give the background. Patient have what you describe here. Just focus your background on your situation that patient get dehydrated. Your assessment, why you think patient dehydrated. If patient like edema, if patient like just drink 2 cans of Coke on the bed, then there's no reason she dehydrated, right? So tell the situations, your assessment, why you think patient dehydrated, and then your suggestions. Got that? Yeah, we start very simple, very straightforward. I give you all the details. Let's go from there, and along the way, is the queue will be less and less, and you will just do the SBAR all by yourself. All right. So I hope that the rest of the class also listen in, take note, and then next time we don't have to repeat everything along the way. Okay, so go ahead.
To repeat her condition, I lost some words.
Okay, so her condition is you suspect she is dehydrated. She could not eat, she could not drink, she been vomiting from her conditions. You saw her in emergency, you suspect she's dehydrated. So yeah, do the SBAR on that case.
Okay, Dr. Min, I got a patient who's, I think, suspected of dehydration because I see that she is not able to eat and drink for almost 1 day, and she vomiting a lot, and I can see that her pulse is rise over 100 beats per minute. And she may got a fever above 38 and 38.5 degrees Celsius. Especially when I see on her lip and her eye, I can see that the skin bring the skin wrinkle. So I think that she is at degree 2 of dehydration, and I recommend we need to set up an intravenous cannula, intravenous catheter to provide fluid to her first.
Okay, that's a good start. How you think about? Yeah, we don't have another one to give feedback for the performance right away. But let's see. So I think for this, you good on the situation. You give directly right away that you suspect patient have dehydrations. But I expect, normally we expect you to give a bit more detail about the patients. At least you should tell this patient like, yeah, so that your supervisor has some idea like who the patient is, a male or female, the age of the patient, why the patient here for, and yeah, maybe you can tell your suspicions of your suspicions of cholecystitis. Yeah, we are working up for that diagnosis. If you don't have that diagnosis yet, you still can see that we are thinking that she have cholecystitis. Yeah, so give some picture. You say that okay, but otherwise you cannot. What the patient is? Why? Who that patient have the dehydration? You have no idea, right? So give some picture about the patient. That patient's coming here, pain, suspect dehydrations, suspect cholecystitis, and yeah. So that is for the background. Okay.
Okay. Because you say that I have to go straight, so I focus on direct condition.
Oh, okay. Yeah. So we go along the way to see how much is enough, how much is too little, how much is too much. So yeah, step by step.
I have a suggestion, Min.
Yeah.
I asked the other one, do the same like that. Okay, after Dr. Min's feedback, do the same case like that. Okay, and how you report to your supervisor. And then the same case like that. And according to Dr. Min's assignment, the people who talked to the patient's husband, that's correct. If I just look at it in the assignment. So the way we talk to the supervisor is different from the way we talk to the patient's family members. Okay, so try a little bit to see that, and then we just play around that, and then we go with the other case. I think it should be faster. Okay, yeah, that's my suggestions. It's not Khoi anymore. Somebody else report the same to supervisor, the same case, but how you report it? Team A, the other members of Team A? Anybody?
Seems like the connection is slow. It gets stuck over on the outside.
Okay. Quick.
Can you hear us from Kansas?
Yes.
The connection is kind of unstable. Sorry.
Mm-hmm.
So
Yeah.
we need another member from team A, right?
Okay. Yeah.
Bạn nào làm được? Giờ mình xung phong present case tới vô the patient relative anh được không?
Yes.
Vietnamese.
Yeah. Seems like the connection is bad. So.
Any shark there?
Some shark is biting the cable. Yeah. So can you hear us over there?
So, Ngọc Anh will try.
Oh, the connection is horrible today. Yeah, the voice gets chopped up. Yeah, I cannot understand. Yeah, seems like it's not today. Not today. No sound from you, Andin.
Hello, can you hear me?
Okay, I can hear you now. So again, I hope you hear my feedback for the first presenter. So let's do this situation of dehydration again. Give a little bit more background information for background, and try to be more direct, more concise on the assignment. And yeah, okay, let's go.
Good morning, Dr. Mindo.
Mm-hmm.
I want to ask you about Mrs. GB case, who's I think have dehydration situation right now. She was admitted to the Mrs. JB's 40 years old woman come to the hospital because of right upper quadrant pain, and she have and it started 2 hours ago with the sudden onset after her meals, and she feel like dull and cramping, and the pain is with fever and vomiting. Based on all the evidence, we have diagnosed her with cholecystitis. But right now situation, I saw that she nauseated. She's vomiting a lot. Her temperature is 38.5 degrees Celsius. She has food intolerance, and she cannot drink water. Physical examination shows that her skin is really dry. Therefore, I think that she have dehydration. And I suggest, should we put in her intravenous catheters to give her saline fluid to treat for her dehydration situation.
Mm-hmm.
Yes.
Okay, that's better. I hope that the listener get a better picture of the patients. Some may think that it's subjective, but some may think that the background may be a bit shorter. It depends on the level of trust between you and the provider. you and your supervisor. If they trust you, your clinical skill, then you can just straightforward say that that patient admitted for right quadral upper quadral pain, and we are currently work her up for cholecystitis. That enough for the background, because actually if anything else, most of the other situation, what we worry about is dehydration right now. And if you give enough information on the assessment for the dehydrations, that enough. The pain turn out maybe something else, but if patient like significantly dehydrated, we give IV fluid anyway, right? So you don't need to give too much information about your suspicion towards the diagnosis of cholecystitis. You just may need to try to convince your supervisor about your assessment about the dehydrations. You can talk about the heart rate up, patient look dry, the lip is dry, the tongue is dry, fever, she's not making any urine on your supporting information regarding the dehydrations, and you suggest the IV fluid. Most of the time in the hospital, I'm not sure, but most of the time we have the line in already, so we just suggest that should we bolus her like 500 cc of saline, thing like that. That's how the case should be. But better you pick up the suggestion along the way, and you do it better. So there's no really perfect formulas between to do SBAR, and the one who listen to you can ask more information to clarify the case. So it's like a dance between two persons. You try to do your best, and the other can also ask for more information also. So don't worry, we perfect it along the way, and and it's very active experience. Your provider, your situations, your patients. So just go along with that. But existence, you do a better SBAR right now. Okay, move along. So let's talk about the case we provide. I asked in the you do the assignment. Who's next? Who's next?
Still team A or another team?
Let's do team A then. Let's do team A then, but this time I want someone from team B to listen and to report back the case, the situation. Hello.
Yeah. So I heard that Dr. Đinh Văn said need someone to report the case when the student talk to the patient family members. So do I need that case about the same case?
I think if you want to try that, it's fine too. Try to tell the children on the bedside that you need to give her mother the IV fluid. Maybe not normally we don't. You may not do it all the time, but let's see if you can talk in the layman term about the reason why you think you should give his or her mom IV fluid. You want to try that? So I'm the son who sits by bedside.
Okay, I will start my situation. Hello, are you Mr. TV's son?
Yes, I am, doctor.
So in your mom's situation, that I think your mom needs some medications because she admitted with belly pain, fever, and now she is vomiting a lot. Yeah.
Yeah.
And now you can see that her urine volume is very little, and with this recent situation, I'm afraid that she mustn't drink or eat because her belly pain and vomiting. With the diagnosis of the doctor is she has gallstone in the gallbladder and make she feel very bad. And if we don't do anything for her, I think she will have the situation that will just she can bring, so maybe she will have the water loss. So I think she needs some intravenous fluid to help her better. So I inform for you.
Okay. My mom cannot. You say my mom cannot pee, and then you give her mouth fluid. Then where the fluid should go, doctor? My mom cannot pee, so you give her fluid, and she's balloon up. Is that right?
Yeah, because I have examined your mom bladder, and I can feel any just like balloon in her abdomen, and I think because that she lack of water, just not by she can pee because there's nothing to pee.
Okay. Okay. And then just laughing along the way. Yeah. Actually, I think that's one situation of a little bit too much information for the family. You may scare the son a little bit over here. Yeah, for the son, for this situation, yeah, if for surgery, then you need to give more information. For this dehydrations, yeah, it's maybe a little more straightforward. Yeah, you can see that you can ask if your mom cannot eat, cannot drink for a day right now. Seems like she's 30, but she could not keep anything down. She could not keep the fluid down. Yeah, and she's look dehydrated. Her mouth is dry. Her skin is dry, and that's why we suggest to give her some fluid. So yeah, keep it simple like that. Yeah, for this case, for dehydration, don't need to over explain the situations and scare the family. Yeah, so it's the balance between too much information, too little information. How you think enough is enough is a little bit subjective, but that's the fun in medicine. If you give too much information, they will ask you a lot of questions, and yeah, it's just unnecessary for you and for the family also. Save it for more complicated situations, more significant, more severe situations. Okay. Got it? Yeah, so for simple issue, keep it simple.
Okay.
Yeah, I got it.
Okay, I would like to tell you something. When you talk to your supervisor or your colleague, your co-worker, you use a different terminology, different type of level of communication. But when you talk to the family member, you have to make it simple, easy to understand. Okay, for example, in this case, you just say that, okay, hi, Mr. Bebe, I would like to tell you that your mom is a lot of vomit and nausea. She cannot eat and drink. So that's why she don't have enough fluid in her body. So we would like to give her more fluid to make sure that she is okay. You can see that her pee is less because she doesn't have the fluid. Okay, something like that. Very simple. So don't go to dehydrations or voiding or something like that. Okay, just make it simple. Okay, yeah. And in a different way, yes. But in a different way, when you report to your supervisor, you have to say differently. Okay, for example, okay, hi, Dr. Mindo. My name is Dr. Van. I'm a physician in emergency. I would like to tell you something, and I ask your opinion. Okay, Mrs. V or something, 48 years old. She just admitted this morning, and she has a pain in the right upper quadrant. But what we concerned right now that she has a lot of vomiting and nauseous, and she haven't eaten anything and drinking anything from 3 days ago. So we concerned that she has dehydration. So how do you think that we can give her a bolus through the IV and something like that? Okay. So you see that you just concentrate on what the main concern, okay, but different language to different people. Okay, this one make more skill, okay, but anyway, you have to go from upper level of language to lower. It depends on who you talk to. Okay, so today we would like all of you to practice it, and I would like to see that how you can switch from one level to the other one. Okay, and use very simple case that you talk. Okay, no need to go to the whole medical history or something like that. Okay, just concern because SBAR is the report and recommendation based on a specific situation. Okay, yeah, go ahead.
Thank you, Dr. Min.
Yeah, okay. Microphone, mic. Yeah.
Okay, so let's switch team. The other team may be sleeping right now. So let's do the scenario in team B. Team B, who's in team B? Team B, okay. Team B, and let's make it more engagement this time. Who's gonna present? Team C, who else in Team C gonna take note? The whole Team C will take note and I will add randomly. Maybe let's make it easy first. One in Team C will take note, the other may help him or her. So Team B will present the case and I will ask back Team C if they got the information correct or not. Okay? Ready? Okay, so Team B, just to make sure I got the right information and you understand the situation, tell me what is your primary diagnosis on the case on Team B?
I think Mr. TN has esophagus cancer.
Okay, it's your primary diagnosis. We haven't confirmed that yet, but yeah, that's what we are really worried about. All right, so listen carefully. Your situations, just like what you mentioned over here, he came to the emergency. He had, you suspect that he has esophageal cancer. So you planned to do imaging study on him. Okay. Imaging study, some X-ray, some CT scan, whatever you choose. So you want to ask the radiologist to read to tell you what about the case before he do the test. I don't know how the situation in Vietnam, but in US, when you order the test, you always give a short background about the case so that the radiologist will direct their reading to that to help you. It's not to help you, not for anything else. If you just like X-ray chest, no reason, then it's really difficult or very vague for them to help you. If you say that X-ray chest with contrast or X-ray barium swallow, suspect esophageal cancer, things like that, then it will be much more information for them and for you. Okay, so which imaging you plan to do for this patient? For esophageal cancer, which imaging you plan to do?
I answer directly or SBAR
no. I just ask you first before you start SBAR. Which imaging you plan to do for this patient?
I think barium endoscopy.
Oh.
Endoscopy.
Endoscopy. Oh, is the procedure a GI procedure? Normally we don't do that first. You don't do any X-ray first or any CT scan first? No, not first. You go straight for endoscopy. I think over here you mentioned that.
First, I will give plain X-ray, plain chest X-rays and barium swallow X-ray.
Okay. Okay. So yeah, let's talk about the barium swallow. So I am the radiologist, and one of your friend in Team C is the radiologist. Tell me about the case and your suggestions for the radiologist to do the barium swallowing. Okay, so tell us about the case and why you, what the background is, why you suspect he has esophageal cancer, and what test, why you suggest that test. Okay.
Okay. Hello, Dr. Minh. I'm Ngân. I'm from emergency room, and Mr. TN, 65-year-old, is admitted this morning. He is presented because of his dysphagia and epigastric pain. About background, he has epigastric pain for 3 weeks ago and dysphagia for the past 5 days. He lost 10 kilograms and significant loss during the past month. Past medical history, he has been taking PPI for 4 years for his acid reflux, and he smokes 20 cigarettes, 20 packs per year, and he drinks alcohol heavily. He is obesity. He is obese, and his BMI is 31 kilograms per square meters, and he looks pale, and the blood test, he is anemia, and biomarker CEA is normal, and I think he is. I suspect he is esophageal cancer. So I think, can you please order him plain chest X-ray and esophagography?
Okay, so yeah, that's a good presentation, but that's a good thing for us to learn. A lot of things for us to learn. All right. So Team C, who are giving, who are taking note about the presentation just now? Who is taking note? Or all of you taking note? Team C. Team C.
Team C, just give just give us your feedback. Turn the mic again.
So so I need to give some feedback about her statement, her speaking.
Yeah.
She mentioned that the situation, her situation is that 55 years old female came to hospital because dysphagia, esophageal pain, and the background information that the esophageal pain lasts for 2 weeks, and she lost 10 kilograms for the last year. Our years. The history, she taking the PPI for 4 weeks, and her kilogram.
Sorry, Dr. C. Okay, I would like to cut it short here. Okay, you don't need to repeat the medical history. We just ask you that what's right and what's wrong from the report of Ngân. What she did well and what she didn't well.
So I think that in this situation, she do well with the SBAR because she give the situation and then she give the background information and she assess that the patient how the diagnosis for the patient, and she suggest some recommendation to the patient with the supervisor. I think she follow good for the SBAR.
Okay.
Yes, sorry.
Not at all. Okay. I just make it short here, okay, because we have many cases and you just learned. Ngân, who is the doctor Ngân have to report? Is a radiologist. And what Ngân recommend, that is make a bland chest X-ray and esophageal barium swallowing. Okay. So I just ask you, why the radiologist need about the history of smoking, drinking, something?
Because in the patient with the esophageal cancer, they will have some risk factor like smoking or drinking beer and alcohol is also a risk factor for the patient with esophageal cancer. So you know, very important to ask about the history.
But the radiologist doesn't need that. Anyway, and something, I just have a controversial here. He or she has the esophageal cancer, so it's hard to eat or something. And the patient still obese. So how you explain that is still obese with the esophageal cancer? If you have to raise a concern, you have to raise concern about that too. Okay. Now let me say, okay, before Dr. Mindo say something, let me say that when you report to a radiologist, you just say that about the patient, the age, the reason, the chest complaint, the main complaint, and the reason why, the background, in order that you ask the radiologist to do something for you. Okay. You can say something about drinking, but it's not relevant in the case that you request, because the radiologist don't need to think about diagnosis, but he need to know that what kind of technique that he has to use with the patient that you have the diagnosis of esophageal cancer. Okay, thank you, Dr. Min.
Yes, again, it's a learning experience here. So we try to perfect it along the way. Too much information to sometimes is not good. Too little is definitely not good, but too much is also not well received either. From my personal experience, radiologists where I practice, they are super smart. And they are super busy also. So if you give a long presentation, you may upset them and they may cut you short. So they really want to know to the point. I know that you want to give a very clear and good pictures about the case, but it's not always necessary. They doctor, you are doctor, we are in the same level, so that's why to present to different people, we must kind of readjust how much information we may give the listener on the other side. Okay, so for radiologists, what you want is to convince them that the patient have something going on in the esophagus. You think that it could be cancer or something obstructed over there, right? So yeah, the main thing is that you try to convince them about that. So like Dr. Din say, you mentioned giving the background, the age of the patients, and then you give the symptoms. Seem like he's been getting gradually problem with swallowing. Is a very, very important thing to mention. You mentioned about weight loss, significant weight loss. And if you want to mention about the history, it's okay to throw it in. But you can just simply mention he's a heavy smoker and drinker. And that is quite good enough already. Don't need to mention how many pack years he is smoking. You don't need to mention how many drink he drink a day, what kind of alcohol or beer he's drinking. It's not really relevant. They don't need to know in that much detail. They just need, okay, it's an A group, it's suspicious, heavy drinker, heavy smoker, is quite a high risk factor. He's been having symptoms for GI, he's been having reflux on the GI, PPI for a while. If you want to throw it in, it's fine. But more important is what he is having right now. He have like progressive swallowing problem. He's losing weight. There's side obstruction over there. So that's why barium swallow is what you are thinking to see the obstruction. Okay, so it should be shorter, and right to the point. Sometimes they just during our training we just allowed to give like 3 or 4 sentences to elaborate the case so that they can tell us what to do. What they see, what they target their view to the case. Okay, so yeah, we learn along the way with with the radiologist. It needs to be more concise, more condensed, right to the point. Okay. Someone else would like to try it again on that case? You follow me, or I'm lost you here? You understand what I say so far?
No, we understand. I think we understand.
Okay.
Person to
Hello, Min. Otherwise, I just call. I have a list of the student here.
Okay, so the next one from Team B. Exactly the same case. See how you learn from the feedback.
Yes, and
okay, Team B.
I will. Yes. Hello.
Yeah.
Okay.
I will do the. Yes, we'll do the same.
And again, just about less than 3 minutes. Less than 3 minutes, and you have to take all information relevant to the radiologist.
Yeah, actually 1 minute. 1 minute. 3 minutes is too long. 1 minute. Can do it. 1 minute.
I try. So hello, Dr. Man. My name is Naman, and I'm from the emergency room. And today we have a patient, Mr. TN, 65 years old, and he was admitted to the hospital because of the pain in the chest and difficult to difficult to swallow, and he has the problem for about 3 weeks ago, and then the symptom become more severe, and the problem is that he cannot swallow, he cannot eat, and the other thing is obese and a heavy smoker and a heavy drinker. And now I think he needs to do some tests to find out what is the problem that he having. And I suggested to do the esophageal barium swallowing test, and I need some of your advice. So can you help me?
Okay. Okay, that's better. That's better. If you, this is okay, but if you strictly want to be to strictly follow SBAR, then you may mention about your suspicion about some obstruction in the esophagus. Yeah, you start with the patient. You're not starting what's your suspicious. There's some obstruction over there. Yeah, if you mention. Yeah, if you talk to the radiologist, you want to ask about the imaging study for the obstruction, then yeah, you can just mention that to follow the SBAR format. I have the patient I suspect have esophageal cancer or obstruction. This is a 65 years old obese, heavy drinker, heavy smoker, and seems like he's been gradually having weight loss and more significant lately. He gradually had problem with swallowing, and now he's very difficult to swallow food down. So I suspect something obstructed over there. I think the barium swallow is a good way to see the obstructions. What do you think? So yeah, just keep it simple and straight to the point like that. Okay. Yeah, we learn along the way, so yes, don't worry. Try to convince the other side what you think and give the suggestion, give your recommendations, and they will give you proper feedback. And if they want to ask more information, they ask more information. Okay, but good, you're doing
okay. Yes, thank you.
better along the way.
Okay. Hello, could we make a break now? Just about 5 minutes, okay?
Okay, let's get a break and regroup.
During the break, you just review your case again, and make sure that you follow strictly with SBAR. Okay.
Okay, yeah. Take a break, stretch.
Okay, class. Before Dr. Min go ahead with your presentation today, I would like to tell you something about the SBAR again. So the SBAR is a very most important that what you talk to. Number two, you know everything, but you talk a little bit and the main and the most important thing only, okay, related to the person that have the concern. Okay, so you know the whole history of the patient, you know everything there, but you don't need to tell everything. So that's is very tough. Okay, you have to pick out which one is the most important and most relevant to the person that you talk to. It's an art. It's not the medical knowledge anymore, huh? But it's an art. How you convey your message in a clear and understandable. Okay. So today we practice again. Okay. We don't go to in detail about pathology, about disease, but we go to how to make communication to everybody. Okay. Thanks. Okay. Now. Mike, yeah.
Yeah. Hello, class. I'm back. Okay, so just make it easier, lighten the mood a little bit. Let's see. When we practice medicine over here, I myself sometimes had to write letter to the immigrant service because some of the patients is sick and they would like to have family from abroad to come to visit them. So the letter is to support for the visa application for the family. So yeah, I think I did one just last week. Patient had cancer and dementia, and she would like to have the family come over to visit them. So it's writing letter to support the case like that. It actually is the way of SBAR also. You try to communicate with another party about your patients. The situation is that the family would like to get the visa, and you will try to convince them to convince the immigration service that the patient is sick and may not live long. So that's why you ask them to help expedite the visa applications. You don't need to put a lot of information over there. You don't need to put like how much weight the patient is right now. You don't need to put the vital signs. You just need to put enough information to convince them, and mainly just the diagnosis. So yeah, so we use that all the time in communications, in medicines about the case, about the patient. So try to know who you are communicating to, and organize just enough information for that for the goal you are communicating with. All right, so let's see. Let's do team B again and again. I want someone from team C ready to take note. Team B is ready. Who's gonna present team B just this time? Who else not talking, not saying anything yet? Oh. Okay. Stuck over there. Okay, so and ready?
Yes.
Okay, so yeah, so the patient is now in hospital. He is hospitalized for workup, and the situation is he yeah, so the situation is he could not eat, he could not swallow, and the medication, the PPI medications we give the patients, and you give the patient, he said that he could not swallow that. So you are the nurse, or you are helping the nurse to report to the doctor who take care of the patients, suggest to change to some liquid form of PPI, or some form that PPI that patient can swallow. How should you communicate that to the doctor? I know you're doctor already, so it's a different role. But let's say you are teaching the nurse how to. You just play the role of the nurse, how to communicate with the treating doctor that the patient cannot swallow the PPI that the doctor order, and you recommend the liquid form or the capsule form that you can open and mix with water so that the patient can swallow. How should you communicate with the doctor about that?
No, don't speak Vietnamese in the class. No. Ai Ngọc Anh. Stop.
Busted.
Stop. Okay. English only. Yes.
I present SBAR case situation. The patient go to the hospital because she is difficult swallow and background. She has difficult swallow, and the patient use PPI assessment. I think the patient don't use oral rest recommendation. I will say the doctor, the patient don't use oral rest, and request him to use intravenous intravenous or infusion for the patient.
Okay. You are a bit anxious, so.
Okay, sorry, Minh.
Yeah.
Okay, I asked one member of Team A. Tell us that what's wrong in the report of Dr. Vân and what's good there. Okay, Team A, Dr. Phú. What's wrong there? What's wrong there, and what's correct? What's good there?
I think the good thing that she has done is that she follow quite good the SBAR template, and is short, so we have the core information. But she used some words like situation, assessment, and recommendation, which is not necessary for SBAR.
And what she missed? She missed the name and the age of the patient. You can't jump into something and you don't mention what is the name of the patient, what is the age, what is the Okay, so you see at the beginning, so I asked your supervisor, I have no idea what you're talking about. That's correct? Okay.
Yeah.
Okay, now Dr. Minh, yes.
Yeah, that's actually is the most important thing, because communicating, sometimes the doctor is at home or the doctor at a different floor, and they care for many patients, not just one. So if you not mention who's the doctor and how the patient is, then there's no way. And if we give the wrong treatment to the wrong patient, then it's even worse. You may get sued. Okay, so that very, very important. And also, then it should be a bit more about the communications. So try to make it in the conversation form, rather than just list it down there. Yeah, because you you will communicate with others. So just say the case, you feel the patient, and you can say that the patient say he could not swallow the pill. Then you give the background, the patient's in here with suspect with the primary diagnosis of esophageal cancer. Seemed like he could not tolerate solid food. He's now on like liquid diet, and the pill you gave him he could not swallow. It gets stuck, or he feel very painful. And you suggest like any other form that can mix in the water. Sometimes he still tolerate water, so something that mix in water, IV PPI. Yes. So don't need to list out the assessment, the recommendations, all those things. Of course, no one for you if you list that thing out. Keep it clear. That's fine. But again, we are in the communication class. Make it more relaxed and more a communications way. That's better. And don't be scared. We not we're not here to harm you or for you for anything. But short, to the point, and clear. Give the assessment. So your assessment for people who cannot swallow. Maybe you may give some information about assessment also. Like as a nurse, you may see that it seems like the patient right now on the liquid diet. He was on the regular diet before when he was in the hospital, and he could not tolerate that, and now we have to switch him to the liquid diet. So give the doctor more information to convince him that the patient could not swallow, not just because he don't want to swallow the pill, but some real reason for that. So give some extra information to back up your assessment. It's a good thing to do. Okay, let's see. So now team B, we still with team B. Huh? Team B, anyone here has not saying yet, or we done with whole team B? Anyone in team B not saying something yet? Okay, and now team A and team C ready for feedback. Okay, ready for feedback.
I will call you after that.
Ready feedback, or even you may need to tell us if you get the correct information from team B. Okay, so the situations now is that the patient in advanced stage, so he could not. I mean, yeah, no surgery is option is available anymore. Yeah, it's too late for him right now. So the suggestion is palliative care, and you need to. Oh, this may be too difficult. Yeah, basically you think that. Okay. Yeah. So yeah. So you think that the patients may need to be fed through the tube to the stomach, the PEG tube. Okay. Just yeah, because he could not swallow anymore. Yeah. So you know about the PEG tube, placing the feeding tube to the stomach. Hello.
Yeah.
Hello. Can you hear me?
I can hear you.
Okay. Yeah, you know about the feeding tube, right? Place a tube to the stomach to feed the patient.
Yeah.
Okay. Okay. So right now you need to do the PEG tube, place the PEG tube to help feed the patient. Okay. So now you talk to your GI, gastrointestinal doctor to place the tube for you, or actually surgery. GI cannot do this surgery. Yeah, talk to your surgeons for the PEG tube, for the feeding tube. So how you communicate about this case to your surgeon?
Can you wait for me 1 minute to repair?
Okay.
Yeah.
The other
Thank you.
team, yeah, the other team also get ready for feedback and report back the case. Okay. I can do this case. I think I may not. Yeah, I think surgeons may need to do this. Yeah, because it's gets blocked here. I don't think they can go through different. Yeah.
Yeah, sometimes in my hospital we do in the bedside. We read the whole incoming do in the bedside in the ICU.
Yeah. Yeah, I think I'm not sure on my previous the hospital, if they can go through, then they may need to have the surgeon to do it. Yeah, if they can go through the doctor, then
they read the whole team endoscopy, and the doctor come in the bedside. We do it.
Okay, yeah, maybe different place, different services. Yeah, for this case, in previously we do with the surgeon. Okay. Ready? Other team ready? We really need you to play focus and give feedback and report the case. You may be the surgeons, so you're gonna report back to your supervisor about the case. So be ready. Okay, go ahead. You call your fellow surgeons about the case.
Hello, doctor.
Yes.
Hello, doctor. My name is Yao. I'm the fourth-year student. I tell you about Mr. Tien, 65 years old. He presented about the cancer. The background is advanced state. He looks so weird and he cannot eat and drink. So I think he needs a feeding tube. And his vital sign now is stable. What do you thinking about it?
Okay, that's short. but the other team, and then go someone from team C got the feedback, and one from team A to report back to the supervisor, the surgeon, chief surgeon.
Okay, sorry. So I asked Dr. T. Yes.
Dr. T again.
Oh, he is super. He is super. I trust that he can say something interesting.
So in his in her sign, she speak is short and followed SBAR, but there's some situation that she shouldn't mention about the vital sign. I think this is better shouldn't mention about the vital sign to the surgeon, because he mentioned that the vital sign is stable now. We don't need to tell that information to the doctor. And that's all.
Okay. And anyone else? It's very interesting with the Zhou's report. You missed something there. Okay. So Dr. T said that the vital sign. That's okay. Okay. It's not. It's which
I
one
think,
that when you make the
one thing that she forgot is that she doesn't mention about the problem with the patient. Like she's thinking about esophageal cancer in the last day, and she should suggest that the patient cannot eating and drinking by oral, her mouth. So she lack of that information.
Okay, something that because I couldn't hear very clearly about Joe say, but when you make a suggestions that carry out with a packed insertion, so you need to make sure that this is the only way that we have to do, because some people cannot eat and drink, but maybe temporary. That's correct. So you don't need to put the pack right away with the temporary people that cannot eat and drink. Okay, so you have to prove that the patient can't permanently eat and drink, or at least for a couple of days or weeks or something like that. Okay, so you have to mention about that. Number two, when you start to make a suggestions with a pack tube, you have to make sure that the patient is ready for that surgery too. Okay, so something that is like maybe make sure that the empty stomach, the stomach is empty, and something. Okay, the patient is in a good position, and everything is repaired. Everything. Okay. Sometimes you have to ask that it's available for the team to do that too. Okay. So.
Okay. So anyone from the other team can report back to the chief surgeons, the one who is on the other on the receive end. You think you can get enough information to report back to your supervisor about the case from team B? Yeah, I want some the listener to see if they can listen the case and report back. You want team B to present again, or you think you get enough information to report to the supervisor right now?
Okay, sorry again. I just read from Dr. Luang's feedback, so it's a very interesting too. That is, what is the possibility that between the nasogastric tube and PAC tube in this case? You have to prove when you ask to make assertions with the PAC tube, you have to say the reason why they put it there. Why we don't put the nasogastric tube in this case. So you have to make it clear in this case, okay? Oh, thanks.
Okay, I want one from team A to report back the case. You think you're ready for that? Or you want team B, another one from team B to present again the case for you? Team A, anyone from team A?
Okay, I call.
Yeah.
Hello, Dr. Minh. Cái gì? Okay, hello.
Okay, don't be afraid. Okay, this one is our practice. Okay, the more you practice, the better you will. Okay, so don't be afraid of that. Okay, it's not a punishment. That's it. Okay, that's learning.
Okay, so you are the surgeons, and you listen to the request from Team B. Now you have to present the request back to your supervisor. What should you tell the supervisor about the case? Basically, just the same or similar to what the other team present you. So I just want to make sure that you got the correct information and present the correct way.
Okay, so first, hello, doctor. My name is Trúc. Today I want to talk about Mr. TN, who he is 65 years old and he presented with esophageal cancer. His doctor reported that he can eat or drink, and he suggested that we should use the tip to help him in eating or drinking. So the patient was ready and prepare for the surgery. So what is your recommend?
Okay. Yeah, it's not bad, but yeah. So understand the situation, right? Understand the situations. You now not the treating team. You are the consulting team, and the other team asks you to help with the pack tube, placing the feeding tube. So you should say in the situations, you can say that yeah, we got requests from the medicine team to place a feeding tube for a patient today, and you give the background, the 65 years old patient whose name is like that. They suspect like terminal stage of esophageal cancer, who could not eat and drink and need the feeding tube for his nutrition. Seems like there's no other option or permanent option to feed him anymore. So that's why we think that we may need to proceed with the. I think that we may need to proceed with the feeding tube. So yeah, the thing from your side as the surgeon. So basically the same kind of information. You just may need to frame it a little bit different because you not the treating team, you are the consulting team. Okay, so just a little bit different, but that how things change in communication between you to the different team or to your supervisor. You got that?
I have idea when we do procedure in the patient. Very important, we need the side consent form. That means I don't heard about you guys discuss about this before we talk or supervise or something, because this is important. If the family, the patient, they refuse, we don't need to go on the set. That means every you report together, you need about, say, we done for sign the a consent form or something. This
Yeah, that's a very, very important step in any procedure. I don't know we have time for that for today. Maybe we try that later on. It's also the kind of communications. Actually, I put it in one of the case, I think team A or team B case about the cholecystitis when you talk to the husband. Let's see, we have time to go there. It's also the communication way when you tell about the situations and the background and the options for the patient. So basically, it's also a type of SBAR, but more in the specific group of consent. We may talk about that a bit later. Okay, so yeah, but that's very important. Thank you, Lam, for reminding us about that. All right, now Team C, you are ready? So which one in Team C will be the one who present first?
Thảo. Okay, she's ready.
Okay, let me put up Team C case. Team A. Where am I, Team C? Team B. Team B.
Okay, Thu Thảo, just wait a minute. Okay, Dr. Minh will give you the case. Okay, just a minute.
Okay, yeah, I just pulled up the Team C cases over here. Okay, so before we begin, again, can you tell me about the diagnosis, your primary diagnosis about your case?
About my team is diagnosed with kidney stone.
Okay, all right. So your so your situation is the patients came to the hospital for the pain as mentioned in your case. Okay, and now he's in bed right now, and he's complaining of severe pain. You are the student. The doctor asks you for help him with pain medications. How you sum up the case to report to your supervisor to help him with more pain medications. You hear what I say?
Yes.
Okay.
Yeah, I like now I mean my.
Yeah, I'm your supervisor. Your patient is in severe pain. You think that he needs more pain medications. How you present the case to your supervisor and ask for more pain medication for your patients.
Hello, Dr. Min. My name is Thảo. I'm a medical student, and my patient is Mr. KS, 45 years old. His complaint with left upper pain, and his vital sign at table, and pain level is several pain, 9 to 10 pain, and and he had he the band was sadly intermittent with each episode last for 30 minutes, and each was succeeded by working and relief with the rest. And he also felt nausea, first benign vomiting in June, and he didn't notice any change in urinary frequency and dysuria. And about his medical history, he didn't take any medication, and he denied of using alcohol and cigarettes. Yeah. About my assessment, he was very tentative of palpation on his left over lateral angles, and about my diagnosis, he kind of son. So I want to ask you about my plan that I want to bring I want to bring his about medication like NSAID, and I don't know exactly what the name medication I would do for my patient.
Okay.
Okay, I would like to ask you some questions here. Your report, or no? No. Number two, the patient in very, very terrible pain, and you think that his or her vital sign is stable? You say that vital sign is stable? You believe that?
She may need more clinical skill for that.
Okay, no. Okay, so now I just want to say that, okay, you have to go strictly with SBAR, okay? And it looks like that you just report to like a case report, something that, or the medical history. Okay, now, Thu Thảo, try again, okay? Shock, 1 or 2 minutes. And you talk to your supervisor, is Dr. Mindo, and talk about the situation that you have to make a recommendation to Dr. Mindo about the pain medication. Okay, now go ahead, go back again. Don't talk to the other people. Okay, okay, straight, go straight. Concentrate on your story.
Hello, Dr. Min. I'm Thảo, I'm a medical student. I have a problem with my case, so I want to ask you. My patient is with the chest, he 45 years old, and come for first left upper warren pain, and I think and he had several pain, and so I want to give I want to give his medication to reduce his pain, and because I think he has kidney stone, so I want to ask you.
So, as a supervisor, so did he get any pain medication so far? Did he have any pain medication so far?
No.
No. Okay. Okay. Do you have any allergy to pain medication? Any medication that you know of?
He doesn't.
Okay. Okay. And so which pain medication you suggest, you recommend to give him?
I recommend NSAID.
Mm-hmm. Okay. Okay.
Okay, could I ask? Okay, now, first I asked Team B to feedback for the second presentation from Thu Thảo.
Okay, Team B.
Thu Thảo, what she missed here? Okay, Team B, I asked Ms. B in that presentation, what Thu Thảo missed very, very important. Okay. Yes?
He's absent today.
Oh yeah, okay. Now, any volunteer? It's very, very principle and very important that you learn at the beginning. Okay, I give you the cue. What is the miss here? What Thu Thảo miss here? Anybody volunteer to tell us?
I think
yes. Yes.
Yes, I have some idea that Thảo miss to describe the pain level and
excellent. Huh? You said that terrible pain, and you don't say how the rate of the pain. You see, you miss. Okay, so Naman, very good. Okay, yeah, I say to the whole class, when you say about pain, you have to ask the pain scale from the patient. And Thu Thảo never report to supervisor about the pain scale. So how the supervisor know to treat the pain? Okay, Naman, thank you very much. Okay, you're very good about that. Okay, thanks.
Yeah.
Okay. Yeah. So Thảo, this time Thảo speak up louder. I can hear her better this time. So that's good. And again, don't be shy. Don't feel worried. The better you sound, the louder we can. The more we can hear you, the better feedback we can provide for you. So yeah, that's good. And again, the assessment, I think your assessment and your feedback to the doctor is and the recommendation is a little bit not strong enough, but we learn along the way. Okay, yeah. Just I don't know the situation, but what I meant in the case is that the patient received the standard pain medication and is not adequate. So that's why you need to ask for stronger pain medications. Not only for NSAID, the nurse, it's kind of standing protocol, standing order that the patient should receive already. If patient haven't received even NSAID yet, then there's no reason to go to ask the supervisor for NSAID. It should be there in the standard order. maybe I'm not clear in my case, in my instruction, but patient received the standard pain medications, but he still the pain is still too severe for him, and that's why you ask for stronger pain medication, some opioid type of pain medication for his severe pain. But the assessment for pain, you should give more information to that to help the supervisors give decisions. You should say pain level. You should mention that he received several doses of NSAID and still complain of severe pain with tachycardia, with sweating, whatever your assessment is, to convince the supervisor that the current pain treatment is not adequate. And also you can mention that he's here working up for kidney stone or renal colics, and that one thing that you can put in the background for the case to make it clearer for the supervisor. Okay, so let's see, anyone can do the same situation again, so that better, so that Thảo can learn from the situations we given. And then who should sit next to Thảo, or anyone in team C can present the situation again, very concise, to the point. And teammate ready to report. Anyone teammate ready to report back?
Hi, doctor. My name is Ngum. I'm a 5th year medical student. Today, I want to tell you about a patient. It's a Missy Chaos, 45 years old, presented with severe left upper current pain for the last 3 days. She describes her pain as a sadness, pain, and she also feels nausea, chills. So we think that she had colic. In physical examination, her vital signs, she had high blood pressure, increased her pulse and her respiratory rate, and her pain scale is 9/10. And she already used NSAID for a couple doses, but it doesn't work for her. So I want to ask you what kind of painkiller we can give her to relieve her pain.
Okay. Of course, not perfect, but better. Teammate, any feedback from teammate? What you think you should do different, and report back and give the better version of the expert.
I listened to Monique that year. I listened to her presentation, and I want to give some feedback for her. Like she followed SBAR, but in the history taking examination, the pain score should be in the history asking, not examination. And when you give NSAID, you should assess again, does it reduce the pain score or not? And in the recommendation, I think you should recommend something, not asking. Like I should give some stronger pain medication, like opioid, or something to relax the muscle. I don't know the name of that word. That's my feedback.
Okay, good.
And not ask for it.
Yeah, I think that yeah, actually, it's what they mentioned. If you be able to come up with good recommendations, that means you understand about the case. If you're not quite sure, then in real life you may ask someone or go look up some information about the case before you call for SBAR. Of course, don't take too long. But yeah, that's why we call the SBAR. The R is recommendations, not questioning or asking for advice. So that's good. I think the situation, she did not come right to the situation. She just said, I have the problem or the situations. So it's not really fit into the typical official SBAR. You may, yes, you may start that I have I think I had the patient which may need more pain medications. So the supervisor may zoom in to say, okay, there's some pain case here that I may need to see which pain medications the patient may need or why the patient need more pain medications. And for the background, yeah, proceed to mention about the patient, the age, and the situation the patient in, and currently working up for renal colics, and the assessment focus on the pain. Yeah, I think the pain level in the assessment, I think, is still okay. You may mention in the background that patient come in pain 9/10. But in the assessment, you can mention that also, as the patient received several doses of NSAID, pain from 9 down to 8, and still, yeah, in severe pain with like tachycardia, panting, high respiratory rate, sweating, and feel nauseating. And if you are really good, you may check that the patient have no history with any allergy to opioid before. Yeah, because if NSAID is tried and not work, I think the next step, as you say, is opioid, and you may help your supervisor by checking, telling him that you check and he have no previous problem with opioid. So yeah, if you give a good well-rounded case, it's helped the provider a lot, and it's also show that you are a good student in medicine. You cover everything. Other than that, otherwise the doctor may ask back, hey, the patient, do you have any allergy with that? Is this patient nauseating? Can he tolerate the pill or not? Things like that. So yeah, try to cover on the options so that they know that you know about the case and you really care for the patients. Okay, that's good. So we back to team C. Let's see the situation. Team C, who will be next?
I will ask Mộng Tuyền. Mộng Tuyền is here.
Okay, so.
Hello, Dr. Mendo.
Okay, hi. So yeah, your situations again. Now you know that the patient had the pain, and you find out the patient had the kidney stone, and seems like the stone is big. You need to have your surgeons your surgeon friend to help you, or the urology service to help you. So how can you communicate the case with the urology? You find out the stone is like 12 millimeter. Seems like it's unlikely to pass. So give more information to convince the urology that they need to come in and help you. Otherwise, they're going to push back. Hey, just wait for the stone to pass, which which is normally the practice, like blocking away that don't take more patient in service. Okay, so the stone is big. It may be hydronephrosis, whatever. Try to convince the urologist that they need to take care of the patients. Okay, go ahead, Tim.
Hello, Dr. Minh. My name is
Oh,
Tim.
wait. Team B, ready to give feedback and report back about the case. Okay, you are the urologist in training. You're gonna take the case from medicine from Tuyển and report back to the supervisor. Okay, so get ready. Dr. Din will call any of you to report back, so you will be ready. Okay, go ahead.
Hello, Doctor. I'm Tuyển. I want to report about Missy KS, 45 years old, admitted to emergency room in last morning with sharp and intermittent low left upper quadrant pain. Now she now her pain become worsening, and she rate it about 9/10. 3 days ago, this is the first time she noticed this pain. About her vital sign, she has high temperature, high blood pressure, respiratory, and heart rate is normal. On abdominal examination, I found that she has tenderness in her costal vertebral angle.
Time up. Wait. Again, it's not reporting the whole case. You calling your fellow urologist to help you with the case. You only diagnose the patients with renal stone. You don't think that the stone will pass by itself, which means medical treatment is not possible to help with the stone. So you don't need to tell them the case. You don't need to tell the process to come to the diagnosis. You can go straight to the diagnosis. Okay, so again, start again. I can just cut back time, but team A, team B still ready to give feedback. Okay, now again.
Hello, Dr. Minh. I'm calling from emergency room. I want to report about Missy KS, 45 years old, admitted to our hospital this morning. Based on her symptoms and on examination, my diagnosis is she had kidney stone, and on in the abdominal ultrasound show that she had stone in her kidney, and the size of the stone is too big. So I recommend that you could I want to order you have surgery for her.
Okay. All right. Team B, feedback. If you are the urologist, you get that request from medicine. How would you feel, and how would you think? Okay. Yeah, there's several things to mention over here. Okay, feedback from Team B. You are the urologist now. You're not medicine. You are urologist. You got the request from Team B, Team C. What's the feedback from the request? What's good? What not so good? What should be different?
Okay, I give the name. Any volunteer?
I want to talk. I want to talk about the TMC. What is the past medical history and vital sign, because you want invite surgeon to surgery kidney stone. So what you don't say about past medical history and vital sign? And do you use any medication for the patient, and is it reduce her pain? This pain.
Okay. Any other feedback? Anything else you may need to ask the team C? Oh, Team A very active right now. Team A need want to get involved. That's good.
Rồi xếp hàng. Không, mình còn anh nói trước mà. Gì cho anh ý kiến trước. So I have some opinions. According to all the SBAR tried of the student, I can see that maybe we misunderstand about what SBAR really is. Like in the like presentation, she tried to describe very detailed about the situation about the patient in order to have the right diagnosis, but that is not correct. The thing we want to know is the problem with that patient, not the diagnosis. So I don't know how we can make it clearer, because SBAR seems to very new to us.
Mm-hmm.
Can I make myself clear?
Okay, before we talk about that, okay, because that's the purpose of today. But after we finish this class, you have very clear idea how you apply the SBAR in your daily clinical situation. But suppose I am the urologist. I will ask Tuyền one question. Okay, Tuyền. Okay. Okay. Through your clinical examination, how do you know that the kidney stone is a big size?
I think she says we mentioned about ultrasound, but
okay, yeah, that's why it's SBAR. Okay, yeah. No, Minh, okay. Let Tuyền answer me.
Doctor, I just tell that in abdominal ultrasound show that the kidney stone is not on examination.
That's good. That's why, because I try to listen to you, huh? Because when you report to the urologist, you have to say, okay, any information relevant. So that's it. If I am not sure that I can hear that or not, huh? But you have to say that, okay, through ultrasound or through X-ray or through something, it shows that the kidney stone is about 3 centimeters in size or something like that. So the urologist has some idea about that, okay? So you got information, but you have to tell which one is most important. That's it. So now again, people may, I'm not sure that now it's already 2 hours already, yeah. But we just practice again, ask about SBAR. Some people have a very clear understand about that, and some people still not sure about that. So maybe we go again with some people and see that what's going on. Or you want us to tell you in short that how you carry out the SBAR? You should know right now. You should know that how. Okay, but through your presentation, some of you didn't catch what is the SBAR. Hello, I give Dr. Mindo about that.
Yeah, I think that's good that Dr. Phu Trọng mentioned about the level of understanding about SBAR. Actually, we communicate all the time. We not, but just in maybe not in the form that is easier for the listener to get a better understanding about the case. You may be a nurse calling the doctor asking for some concern about the patient. You may be a medicine doctor calling the surgeons requesting some service. Yeah, we communicate all the time, but just maybe not in the format that give enough information for the other to understand. Yeah, in practice, you may say, okay, that guys give a good report. I understand right away. And maybe for other doctor that I don't understand what he's telling me about, why I need to do this or that. So that's why SBAR come in. It's just in the format that we can relay the information efficiently. Just like we use the SNP to write up the patient report. SBAR is a form for us to communicate with other people about a situation, about a particular problems. Okay, so that's the goal of SBAR. SBAR not for you to report the whole case over again. SBAR is for a particular specific problem. It's may related to medicines. It's maybe not. So that's why I give you the example about a real life experience, so that just break you off the habit of thinking SBAR is a medical situation. It could be anything. It could be anything, but you should give enough background for the listener to understand about the case, rather than say, "Hey, that doctor, that patient needs more pain medicine." Says, what patients? Why he needs more pain medicines? Right? You need to give enough information about that patient. Why he needs more pain medicines? This patient needs a feeding tube. Why he needs a feeding tube? He have terminal cancer. He could not eat. He has something obstruction in his esophageal, likely for esophageal cancer. So that's SBAR is for, not for you to report the whole case, for you to tell the other people about the situations you have, so that they can help you efficiently. Okay, so are we already clear about that? Okay. Okay, so give enough information, particularly for that. Just give an example. Like if the patient, it's happened in the US, maybe not in Vietnam, but maybe in the US. A patient live alone and have a cat. He's went to the emergency and the doctor suggests him to be admitted for further investigation and treatment. So who's gonna take care of the cat at home? So you're gonna talk to the social worker about the patient who have the cat at home, right? So it's totally non-medical. but you mentioned that, hey, this patient need his cat need to be fed, and you can mention that this patient live alone, who have a cat at home, and right now we need to admit the patient to the hospital. Likely he stay for several days, and the cat, no one to feed the cat. So the social worker, then you suggest the social worker go find someone to help him with the cat at home. So it's the situation like that. It's not medicine. It particularly you just give information for the other people to help you, and enough background information for that. Okay, clear? Clear? Hopefully. Okay, again, we are on the very early stage of the learning curve over here. I hope that you get some idea about the SBAR. We almost 2.5 hours already. Maybe we should stop around 10:30, so we have like 7-8 more minutes. Anyone who think that he or she clear about the SBAR and would like to present again? Or anyone haven't talked yet?
I haven't talked yet.
Okay, good. That's a good attitude. So you are team B?
Yeah. C.
Team C?
Yeah.
Team C, why you sit there? Team C. Let me see, Team C. Okay, so let's see, Team C. Ready? Let me give you a totally new situation right now. And yeah, so that's why how things going on over here in medicine. Sometimes there are a lot of unexpected things happen. Okay, so Team C still the same case. Mrs. KS come in here. You find out that she have the kidney stone. You ask the urologist to come in and to help you with. They decide to do the endoscopics to come in and check the stone, but and they remove the stone. And now the patients keep peeing out, urinating blood. Okay, after the procedures, she keep urinating blood. And okay, so you think that could be something in her bladder? You would like to ask the urologist to check again whether with cystoscopy. Yeah, just one thing to recommend for you. Yeah, to see if there's anything inside. They break the stone, it should heal, everything should be good for now. She have no pain anymore, but she keep peeing out blood. So you want to check. Okay, so what should you tell your urologist right now? Team A should be the urologist. Team A ready? Team A ready? And don't.
Yeah, will I present now?
Yeah, go ahead.
Okay. Hello, Dr. Mun. I'm Dr. Tran from emergency room. I have a case. I have a patient that.
Okay, I just want to make it clear. So the patient, you was admit the patient like a week or so ago. She got treated. She went home, and now she's back to you because she keep peeing out blood. Okay, get the case clear. It's still the patient. You know about her. She had treated for renal colics. The urologist helped remove the stone, and now she's back with blood in her urine. Okay, 1 week later. Okay, so yeah, just make you sure you understand the case. All right, go ahead.
Okay, I'm Dr. Tran from emergency room. I have a patient that I have
blood urination. Admit to my department today. She has been diagnosed that in kidney stone before, and she underwent a surgery that removed this stone last week. Now, but she don't feel any pain, any pain anymore. But now she still notice some blood when she's peeing. So in my opinion, but no, but she don't feel any pain, any fever or something like that. Now, in my opinion, I think there's a problem in the bladder after surgery. So I would like to ask you to review her again and give me some advice. Thank you.
Okay, it's your smooth here. Okay, team A, any feedback for team C, or as a urologist, you have any other question for team C?
Okay, if I were an urologist and after hearing his SBAR, I would ask him if he had done any investigation to rule out some common diagnosis before asking me to do again the procedure or something like that. Do you think of it is a scratch in the wall of a bladder, or is a infection in the bladder, something like that? Yeah, you need to do more things, and the last thing is what you told me to do it again.
Okay, you know, the key word here is redo. What's the meaning of redo here? When Tuấn asks a urologist, okay? So is a very, because redo is a redo the surgery or just the uroscopy. So you see, so just make it simple here, okay? Just ask the urologist, could you have a look at it? It's easier for you to prevent everything. So if you say that, oh, could you redo it? What redo? Okay, that's a reaction of urologist. Okay.
Yes.
Yeah. Okay. Thanks.
I feel like offended.
Yeah, the assessment, I'm not sure. Yeah, if you want to get the urologist help you, yeah, make sure that you do some basic assessment first. Blood in urine, but it's reducing in the amount, blood like red blood with blood clots, and what you think is could be, whether a stone is still in there. Did you check for any leftover stone in there? You think it's just something totally new, that bladder cancer now start leaking out blood. So yes, some more investigation to convince the urologist to help you. But Dr. Fu, from practice, what we call blocking over here, when other service in residence call for one service call for the other, because they overwork, so they try to block it. They try to make the other team to do the good initial assessment first, and it's fair. It's fair, yeah, because if it's just normal expected things happening, why they need to call other service to waste their time and money? Do the better assessment. If you already did, do mention that in the assessment. Okay, not just because the patient pee out blood and vitals okay, and I call you for your service, and yeah, it's not fair at all. It's not fair at all. Okay, yeah, it's just but seems like you get the whole of it. You follow the format, and then it's come out more naturally. Of course, certain things come with experience and practice, but I think you get the whole of it right now. We're a little bit over time, but any one of you have any question about the SBAR so far? Anything you're not clear? Because for the next few sections, we talk about the SBAR. I don't know how other instructor gonna do it, but yeah, if you have a better understanding about the SBAR, they can focus a bit more about the clinical aspect of the condition for you. So, any questions? Dr. Lang mentioned over here about the soap note. You know about the soap note, SOAP, not the soap that we shower with.
I have searched the SOAP template on the Google, and I know that it is stand for subject, object, assessment and plans.
Mm-hmm. Yeah.
It's
yeah,
a little different from SBAR.
So we you in the bedside more look like student go with me or student go with the doctor. We ask student about soap. No SBAR in the bedside.
Mm-hmm. Yeah. Soap note we use a lot, but it's more about a patient, a conditions, rather than the situation. The SBAR is more specific than the soap note. The soap note is more about disease, like if patient have diabetes, for example, then you do the subjective and objective, including vital signs, including physical exam, including labs and assessment diagnosis in general, and what you plan to do. So it's different. It's a bit different. It's the more official, and it's in writing. The SBAR more about communication. Oh, okay. What's that noise?
Just think about the SOAP framework. That is a case report. Meanwhile, SBAR is a problem report. Okay, so you see it's very clear. Okay, one is in total detail, everything you have to report. The other one is just one situation or one problem. Okay.
Okay, but just like SBAR, soap note can be used by anyone, including social worker, anyone. Some soap notes may be just a few lines, but some soap note is much longer. Yeah, but it's a different way of communication in medicine. Okay, there's some noise there. What's that? Some background noise.
It's in background from laptop. I couldn't unmute it.
Don't listen John the audio conference.
Turn it off. Turn it off. So turn the volume down. So it's
okay.
Okay.
Yes. Okay, so it seems like it's better now. Good. All right. So if we don't have any other question about the SBAR, then yeah, just go home and review the technique, practice among yourself. Again, focus on the situations. Focus your informations on the problem the patient have. Try to convince the other about your recommendations in your assessment. So give enough assessment to come up with recommendations. and yeah, practice among yourself about that. Okay. All right. So seem like with the new speaker phone and microphone system, we move things pretty fast. Thank you, Dr. Phú Trọng, for sponsor that. Yeah, but if we have two camera, it should be even better.
It's not my property. I asked for the money from the university to have that.
But the one who asked is also important. What?
How much?
Oh, Dr. Phú. Hello. We just about to finish.
Phú Trọng, how much for this?
Dạ 3,9 triệu. 3,9 triệu mà chồng thôi.
Dr. Phú Hồ will donate for you this.
Chồng hắn rồi cô ơi.
But what that background noise? So
September I go home. I will see you guys.
Yeah. Okay. Hello, anh Phú. Hello, Phú.
He couldn't see us.
He could not see us. What happened with the background noise? So annoying.
And please put it, turn the volume down. Yes. Good.
Yeah. Okay. Yeah, I don't know why. Okay. So yeah, hi, I'm Phú Hồ. Yeah, we are finishing right now. So, but you dressed so nice today. You went to a wedding party or what?
Yeah.
Đi kiếm vợ.
Hôm vừa rồi để lạc mất vợ hả? Để quên mất vợ đâu đi kiếm vợ.
Đứa nó lạc riết và chán nó lạc. Vậy chứ bữa nay lễ Phật đản. Đi chùa mới về đi ăn ké, ăn chùa.
Ăn chùa.
Hỏi chuyện ok suôn sẻ nè. Ok, sao bữa nay thấy tụi nó happy quá tại mình không lên phải không?
Dạ, chắc vậy. Bữa nay anh Phú đi chùa mới về nè, hiền lành nè, có ai
chưa cạo đầu nữa hả? Nhưng mà góp ý chút xíu cái vụ mà đọc mấy, tại không có gì đọc mấy cái post của mấy đứa. Nhưng mà be careful when you know cái speaking với cái writing, nếu mình directly mình writing giống như cái speaking á, cái language, cái lối hành văn mình nó become is not the right way to do. So may I'm careful when we're writing. Have to be, you know, don't do directly translate exactly what you speak into typing and become sound like just a very, you know, it's not professional and it's not right the way the grammar you do it. And also a lot of grammar problem in the typing, and you know like. And so maybe, you know, like mistake, you know, I can see that. So when you type again, just be careful. You have to go back to look again, and just see what you're posting. Sometimes you post so quickly, and we can pick up, you know, a lot of mistake in there. And when you do investigation, have to justify what you do investigate for, and why you investigate. And also SBAR technique. Sometimes if you use SBAR technique, I'll probably use, you know, you don't use, you repeat, you know, what S, what B, what A, what R. Just use that template and talking through. Not my next bar B will be this and this. Just they give you a guideline, the template, and you follow that. Just use it. They don't use just like repeat the whole thing again and sound like, you know, you just use a bar. Sometimes a bit weird, a bit funny. Okay. But again, a good thing, a lot of, you know, activity for last week. I can see a lot of them. I'm not sure, you know, I can check all of them. But I've seen quite a few active people post a lot, but some I'm not sure whether they post or not.
I haven't seen that. But in view, is it good? Getting better. But I'm still having trouble with someone still try to speak too fast. You can't speak too fast. You have to slow down. And when you slow down, you're a bit weird when you listen. You know, like say, I want to go to the city. Something a bit weird, but again, you get you confident in the way you talk. Otherwise, when you speak too fast, like it becomes easy to mispronounce, make a mistake easily, and your accent, intonation, will become all the big whole trouble in there. Just slow down. No one criticize you when you speak slow, but we will criticize you when you speak too fast and you make a mistake. You're not a native speaker. You got to learn and slowly. When you speak too fast, I can see a whole range of Vietnamese accent, completely. I think they sound like Vietnamese in there. So speak slowly, and Naman just you speak like you try to kill somebody. Just try to be nicer, smoother, and you don't have to stressing the word too hard, too harsh. And sometimes you try to get your voice from your voice box come out too strongly and become a bit more threatening. Just be smoothen it a bit. And T is just still too Vietnamese, too much high accent at the end, too high pitch. Just try to keep the voice a bit in your voice box a bit, and just a bit, not too much high pitch and sound like bit, bit too hard. Tuấn actually he got very good, a way he's speaking quite clear, sound clear, but except when he, he on this, podium something, he start mucking around, and people making mistake. He lost all his confidence. But by himself, he speak quite well, clear, precisely. I can hear, and it sound quite smooth, not really, high tone. And other people, like Kim Ngang, Thiên Ngang, they speak. Sometimes I find it. One day, someday I heard they speak very well. Other day, they just so much Vietnamese accent. Just if you listen back to your speech, you can see something. One day different. Maybe you're tired. When people getting tired, they start, go back to Vietnamese way they're speaking. So just try to keep it consistent and speaking through. And other people, I don't think this week I got time to listen through. I'm sorry, I apologize, but I can see a lot of work. I mean, you're really good, man. Yeah, you're here. But I'm not sure why they just all do. Yeah, why you tell them what to do? Good thing, yeah, good. Yeah. Okay, so late night for chị Vũ Lan, late night for anh Văn với lại Minh. So anything else next week? So okay, who next week again? I forgot.
It's Brian.
Win.
Win.
Win. Okay, all right, good. Okay, so I don't spend more time to listen. But again, I go, student. If I criticize you, don't feel intimidating. I try to make you better. Okay. And I don't feel next time I'm not gonna post it to him or to exclude him. You're unfriendly. I'll try to help you.
Hello, Anfu.
Yeah.
Next 2 weeks, I be out of the country. So if you have time,
travel again. Yeah, fun again.
Next week we will Win, and the week after we will Brian Win. So maybe you help us about that, okay?
Okay. Next Sunday I have the soccer game. So I think today I'm really upset. Liverpool, lost 3-1. I'm just upset. Mohamed Salah, what the hell is he doing? I hate Ronaldo. I said, okay, so I lost. But next week, yeah, I'll try to finish early. I come in, okay. But I'm not going to stay full session.
Okay.
If I lost a game early, I go home early. I go in. All right. Okay. Good.
Okay. Bye, class. Yeah, I'm really impressed with your feedback to your friends on Facebook. So keep up with that. Okay. All right. See you. Good job. Bye.